Have you ever wondered how our wounds heal?
According to hematology.org, blood clotting or coagulation is an important process that prevents excessive bleeding when a blood vessel is injured. Platelets, a type of blood cell, and proteins in your plasma, the liquid part of the blood, work together to stop the bleeding by forming a clot over the injury.
The blood flow normal components are red cells, white cells, and platelets, while in the blood plasma are proteins, salts, ions, fats, and etc. The factors of blood coagulation is the fibrinogen, a glycoprotein that circulates in the blood. Also included are intrinsic factors, extrinsic factor, common pathway factors, and plasmin. When we get a deep cut or a vascular injury, the vascular injury induces platelets aggregation. The first step in healing a wound is the activation of platelets. When platelets touch the damaged wall of a blood vessel, they bind to the injured cells in the wound as well as to each other. During this activation process, the platelets become more rounded in shape and develop spikes. Next, the process of hemostasis begins. Platelets attach to the fibrinogen, and the immobilized fibrinogen attracts the factors of blood coagulation, and the factors of blood coagulation transforms the fibrinogen in polymers of fibrin. After 24 to 48 hours, the molecules of plasmins are attracted to the fibrin net. The activated platelets form a net that covers and fills the wound, and the fibrinolytic aggregation products are phagocyted by the macrophages and the eosinophils. Afterwards, the normal blood flow is then restored.
There are different types of blood clotting. First is deep vein thrombosis. It is the name for when a clot forms in one of the major veins deep inside your body. It is most common for this to happen in one of your legs, but it can also happen in your arms, pelvis, lungs, or even your brain. Next is blood clot in the leg or arm. The most common place for a blood clot occurs in your leg. A blood clot in your arm can have various symptoms, including swelling, pain, tenderness, a warm sensation, and a reddish discoloration. Next is blood clot in the heart or heart attack. A blood clot in heart causes a heart attack. The heart is a less common location for a blood clot, but it can still happen. A blood clot in the heart could cause your chest to hurt or feel heavy, lightheadedness, and shortness of breath. are also potential symptoms. Next is blood clot in the abdomen. Severe abdominal pains and swelling could be symptoms. This could also be symptoms of a stomach virus or food poisoning. Next is blood clot in the brain or stroke. A blood clot in the brain is also known as stroke. A blood clot in your brain could cause a sudden and severe headache and difficulty in speaking or saying. And lastly, blood clot in lungs or pulmonary embolism. A blood clot that travels to your lungs is called pulmonary embolism. Sudden shortness of breath, chest pain, and palpitation are some of the symptoms.